changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We are going to be talking about internal medicine tonight and osteopathic medicine. You know, that's one of my favorite things to actually talk about, because I actually see an osteopathic physician, and until a few years ago, I knew nothing about it, so it's really neat. Like I said, we're going to be talking about internal medicine, primary care, talk about a little bit of difference between, respiratory tract infections versus, the flu and common cold, hypertension, and then also a few other things, holistic well-being, preventive medicine, which is so important nowadays, and age-related needs. So without further ado, I'm going to welcome to the program Dr. Jessica Schwartz. Dr. Schwartz, how are you doing this evening?
Good. How are you?
Thank you. And I always say at this point in the program, thank you, because you're going to take us on this adventure of health. We always learn so much from our physicians. So I know with an internal medicine, it's when we say areas of interest is a little general, general internal medicine, obesity medicine, holistic well-being, and preventative medicine, age-related needs. But it really encompasses just about everything. So I was doing a little research before the program, and I saw one of the main reasons people seek primary care is upper respiratory tract infections. Was I on the right track with that? Is that one of the main reasons people walk into your office?
Absolutely. I think out of sick visits for patients coming in, 75% of them are for some sort of upper respiratory infection. And when we talk about upper respiratory infections, you can be talking about things like the cold, a flu, sinusitis, bronchitis. These are all fall into that same sort of category. And there's a lot of overlap in symptomatology. And I think that's why there's a lot of confusion as to how to treat it and when are antibiotics indicated, when are they not, and how to proceed.
Symptomology. Did I get that right?
Symptomatology.
There it is. I never heard that word before. See, I already learned something already. What are some of the common symptoms like that, the general public, maybe they notice something that's, maybe I should go see a doctor. I mean, what are some of the common symptoms of let's start with upper respiratory tract infection.
So, usually you break it up into, do we think it's a viral infection or do we think it's a bacterial infection, something that's going to require antibiotics? Viral infections, things like the flu and a common cold. Symptoms of the flu typically are a very fast onset of sort of what we call malaise, just sort of body aches, feeling run down, fevers. There tends to be some association with like GI symptoms like nausea and vomiting. And then comes the cold, the typical cold symptoms. So runny nose, coughing, sore throat, headaches, all of those sort of things. Common cold is less body aches, less generalized malaise, more just coughing, sneezing, things of that nature.
And you said the differences is viral versus bacterial?
Yeah. So usually, most times people come in and they say, I've had a cold, I have these symptoms, and I've had them for a few days. Usually, what happens and why people end up needing antibiotics is when the respiratory tract is irritated. It from a viral infection or from things like allergies. Some people are very prone to reactions to external stimuli, such as pollen and things like that. It causes inflammation in the airways. What then that sets you up with is the potential to have a superimposed bacterial infection. So people who get a cold, but they have, very bad allergies or a lot of inflammation existing in the sinuses, those are the people who end up developing an acute sinusitis that then ends up requiring antibiotics.
I'm glad you mentioned pollen because this used to happen to me years ago. I feel like it was like late April, early May every year when we first started to get those, heavy rains here in South Florida, more of the torrential rains, like not like we get like this time of the year, but like the heavy stuff going into rainy season. And the pollen would be washed off the trees, and sometimes I would get, when I was younger, these horrible colds or sinus infection or whatever it was causing that. And the other thing I wanted to add is I feel like a couple of years ago, I'm 42 years old. I've had the flu, I've had the cold, I've had sinus infections, but I feel like a couple of years ago I had this sinus infection that lasted like a month. I should have probably, gone and seen a doctor, and it was like the worst thing I've ever had, way worse than anything else. So so the pollen can cause that and
Absolutely.
That kind of thing.
Absolutely. So if you're someone who's prone to allergies and you get a common cold virus, something like a rhinovirus, your body isn't going to clear it as well as other people's because you're being constantly bombarded with irritation from the outside environment.
I see.
And then if it goes long enough, that's when bacteria can move in and take over, and then you need an antibiotic. And so a lot of times those patients end up needing not only an antibiotic, but like a steroid to take down that inflammation, calm down the system so that you can actually clear the infection.
I see how that works. We're here with Dr. Jessica Schwartz, internist, internal medicine, right here in Boca Raton, 9970 Central Park Boulevard North, Suite 400B. Beautiful office here in Boca Raton on the campus of West Boca Medical Center. Numbers 561-487-7931. DrJessicaSchwartz.com is her website profile. A ton of info there as well. So, if someone has that kind of upper respiratory tract infection, was like me a couple years ago, didn't really seek primary care. Now that I'm getting older, I seem to be seeking it more often. And it lasts more than 14 days. Is that definitely time to get in?
That's definitely abnormal, and you definitely need to see someone because the average cold lasts about 7 days on average, maybe 10. If you're going into 2 weeks and you're still having symptoms, either you have an underlying allergy that's not being addressed, or asthma if you're having more coughing symptoms, or you need to have some sort of antibiotic that there is an underlying infection going on. So
definitely see your primary care if it's lasting. Let's talk briefly about the flu. We have a couple minutes before the break. So this year they're reporting in the news like there's flu epidemic. It seems to be a little worse than maybe the year before. Is it too late to get a flu shot?
No, absolutely not. Essentially, we start prior to the winter season, and then we go all the way through the winter, and that's considered the flu season. So even if, it's halfway through the season, it's definitely not late to get your shot.
I'm putting you on the spot here, but what do you tell people who are on the fence about the flu shot? Because, there's a lot out there, and some people, don't want to get it for certain reasons.
Yeah, I think vaccinations in general have gotten a really bad reputation for various different reasons. And I think now there's sort of this fear in the community that they cause all these extra side effects and things that we aren't readily, saying, or that the medical community is hiding. But we really give these vaccinations because not only for, you're relatively healthy 40-year-old, and if you get the flu, it's probably not going to lead to a hospitalization or anything like that, but we do it for what we call herd immunity, so that we're not only just protecting you, but we're protecting the elderly population that you come in contact with. We're protecting the chemotherapy patient who has no immune system.
I didn't even think of that patient.
So
wow.
It's and children. So it's not just to prevent you from being sick, but that's why vaccinations are so important, because it protects the entire community.
That's great. Great news there. Great info. So we're going to take a quick break, but on the other side, we're going to change the course a little bit and talk a little bit about hypertension and other reasons people see a primary care physician on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Living a Longer and Healthier Life show. We're here with Dr. Jessica Schwartz. She's a DO, Doctor of Osteopathic Medicine, but she's also specializes in internal medicine, also known as an internist, right here in Boca Raton on the campus of West Boca Medical Center, where she is also on staff there. So, Dr. Schwartz, before the break, I teased that we talk a little bit about hypertension because that's not mostly a key word for younger people. Not something I think I know it is, but I definitely wanted to ask you about it because I didn't know that internists could internal medicine could help out with this. But so how can hypertension? What is hypertension and how can it be harmful?
Absolutely. So hypertension is actually one of the most common problems that we deal with as an internist. What hypertension means is it means an elevated blood pressure. So a normal blood pressure is 120/80, and that's pretty much standard across the board for all ages. We tolerate it a little bit higher in the elderly because with low blood pressures, they tend to fall or have separate issues. So basically, the biggest question I get is I get patients who their blood pressure's high and they say, but I feel fine, why do I need medication? And what I like to tell patients is they call it the silent killer, and they call it that because patients feel fine, they feel fine until they don't feel fine. And what happens is when you're putting that much pressure on the vessels of the body, it will cause damage to the microvascular systems of the body. So that includes the vessels that feed the eyes, that includes the vessels that feed the heart, that feed the brain, that feed the kidneys. All of these things become at risk. People develop, issues with their vision. They develop heart problems. They develop, patients have strokes. All of these things are related to having high blood pressure. Okay.
So is that kind of sometimes, do people tell you, if they do have it, maybe they've had like an excited feeling. Because when I think of hypertension, I don't know why, but I think of like, I know this is adrenaline, but like you wake up like suddenly and you got like that feeling of like too much excitement kind of thing, and like your heart's racing. Is that kind of hypertension, or is that a little different?
No, that sounds more like a fast heart rate.
Okay.
Or like, and people do get an adrenaline rush and their heart will pound and your blood pressure can go up. But mostly it's more of a reaction to an excitement. People's blood pressure goes up because they're stressed, because they're under, whatever physiological condition, pain that is causing it. But most people have what we call essential hypertension, meaning there's no cause for, there's no direct cause for it. They just have elevated blood pressures. And while most people are fine and don't need medication, if you leave it for a long period of time untreated, you will end up with these problems in the long run.
Yeah, you said silent killer is the word silent. So like some people, they feel fine and they just don't know that it could be an issue. Wow, and internists treat that as well. That is really neat. Internal medicine is amazing because you get
to be a jack of all trades, and that's kind of one of the reasons why I liked it. You get to see a little bit of everything, treat a little bit of everything.
Neat. Why is routine health maintenance? This is another thing as I'm getting a little older that I actually, make sure that I'm on schedule with my routine health maintenance at this point in my life. But 10 years ago, I would have never thought of routine health maintenance. Why is it so important to stay on that schedule with an internist, or if you're going to a family medicine or maybe even an endocrinologist, just to stay on that primary care schedule?
So most diseases that people end up passing from are preventable in the sense that if we identified elevated blood pressure early on and put them on the proper medications, they wouldn't end up with these long-term side effects. Diabetes is another one. It has the same kind of end results as hypertension. It causes a lot of damage to the vessels in the body. Preventative screenings, colon cancer screenings, breast cancer screenings, all of these, skin cancer screenings, all of these things are important because if we catch them early, we can prevent a lot of the consequences of these conditions. Smoking cessation, that's another really big one. Getting people to stop smoking. Yeah. It prevents a lot of disease in the long run. So what we're trying to do is if you're seeing your physician on a regular basis, we're trying to identify what are your risk factors, what can we prevent for you, how can we screen to prevent you from getting these diseases.
Yeah, definitely. And I share a lot of my info on the show, so people know routine health maintenance has probably saved my life. We've talked about it before, so definitely if you're not going to go see Dr. Schwartz, which I think you should. You're so smart, and the way you explain everything is amazing. So definitely see a primary care physician. But let me give out Dr. Schwartz's info. Again, internal medicine. She's an internist, Dr. Jessica Schwartz. Phone number is 561-487-7931. It's drjessicaschwartz.com. You can just type that in the browser. She has an office in Boca Raton, 9970 Central Park Boulevard North, Suite 400B, Boca Raton, right there on the campus of West Boca Medical Center at Palmetto Park Road and State Road 441. I think that's a state road. 441, I know that much. Let's talk about something that I don't think most people kind of think of seeing an internist for, and that is depression or anxiety. How can an internal medicine or primary care doctor help with those diseases? Because those are debilitating ailments.
Absolutely. And I think it's a lot more common than people really appreciate. I had a patient who told me, I'm having a lot of anxiety, and they felt because there is a stigma against it, and they felt, kind of ashamed. And they were like, do you see a lot of patients who say that they have anxiety or depression? And I said, I would say 80% of my patients tell me they have some degree of anxiety or depression, whether they want to seek medication for it or not. And so we see a lot of anxiety and depression, and we treat it on a daily basis. Obviously, there is a fine line between sort of your everyday issues with anxiety and depression, and then more severe psychiatric illnesses such as like bipolar depression and schizophrenia, ADHD, those people need to see psychiatrists because it's kind of like a patient with high blood pressure. If you're on 1 or 2 medications, it's okay. We'll manage that for you. But if you're on 4 or 5 medications, you're going to need to see a cardiologist. That's what the same thing for a patient who's having severe refractory depression or anxiety. That's when we would refer you out to psychiatrist, because then becomes the intricacies of dealing with those medications and how to stabilize someone's mood. But I mean, like I said, most people, just a little bit of anxiety and depression, they either want to seek psychology or just need reassurance that it's okay. Or want to start medication. Yeah,
definitely talk to someone. In our society nowadays, there's a lot going on. It's easy to, overwork, get burned out,
absolutely,
get down. Definitely talk to someone. Definitely talk to your doctor because that's something I didn't know that doctors could help with.
100%.
It's not something I normally thought of.
And like I said, it exists on a spectrum. So it's definitely worth, if you're feeling that way. The doctor's office should be a safe place, and you should feel like you can express those thoughts and feelings to your physician because we are just there to help.
Definitely. And the same goes with obesity medicine, right? Like there's so many things that a doctor can help you out with. It's not all about sometimes bariatric surgery or this or that. It's about, and correct me if I'm wrong, but it's like a wheel. There's different spokes of the wheel, right? Like if someone has sleep apnea, a doctor can help with that. If someone has a poor diet, a doctor can help with that, etc., right?
Yeah, absolutely. So the thing with obesity medicine is because it's not just about being overweight, but with the being overweight comes these other conditions like the high blood pressure, like the diabetes, like the cholesterol, coronary artery disease. And why I think internal medicine is a good fit for that is because we're trained to deal with complex medical issues that have overlap and are, have intricate needs. And the other thing is not just giving medications. We want to, at least from my perspective, I want to, educate patients on what truly are the diets that you should be following, what kind of exercise regimens are necessary. And the lifestyle changes that are necessary to have long-term success in weight loss.
That's what I was trying to say. Like you can help with so many different things, and by combining all those things and learning that, it's going to help someone lose weight in the long run. Definitely.
The nutrition combined with the medical aspect of it and the lifestyle, that's the way you hopefully successfully treat obesity.
Yeah, and I'm a testimony to that. I see your colleague, Dr. Mitchell Goldstein. He's my doctor right there in that office, and we decided, together that I don't even know if I qualified for bariatric surgery at the time, but he's helped me out with so many things. My big thing was sleep apnea. That was the catalyst that helped me get back into the gym and eat better.
Sleep apnea is very underrated as to how important it actually is.
Oh, I had it so bad, and I was referred to, actually, Dr. Noah Schreibman's been in that chair before. Dr. Goldstein referred me to Dr. Schreibman, and then I got the sleep study, and long story short, yeah, it's helped out a lot. So not too much about me, but we got less than 2 minutes. So let's talk about your hobbies and passions in life outside of medicine. You've shared so much about, primary care here. What do you do when you have time outside of medicine?
I really enjoy working out myself. So I really enjoy running and I enjoy yoga. And mostly I spend a lot of time with my fiance, Mitchell. And we have 2 dogs. We love to take them to the Jupiter Dog Beach and the West Palm Beach Green Market. So a lot of family, that kind of thing.
Jupiter Dog Beach. I like to hear that. I'm originally from Jupiter.
Oh, wow. Jupiter's beautiful.
Yeah, I'm trying to get back there.
Yeah, maybe one day. That's like the retirement goal dream.
And you're also a native too, right? You're from...
I am. I grew up in Coral Springs, went to Coral Springs High School, did all my studying down in Fort Lauderdale, went to Broward General for my residency, so never left.
Nice. And yeah, me neither. It's a great state.
I wouldn't go anywhere else.
Yeah, South Florida is great. Thank you so much again Dr. Schwartz. We'll
Thank
definitely
you
have
so
to have
much
you
for having
back
me.
on. Again, it's Dr. Jessica Schwartz, Internal Medicine, 561-487-7931, drjessicaschwartz.com, on the campus of West Boca Medical Center. Check her out if you're looking for an internist or primary care. I think you'd be happy with her. So thank you, and we'll see you next time on the You and Your Doctor Show.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.